using surveymonkey.com, and most of the respondents, 57% are women and 42% were men. We use Bradford somatic inventory to define specific somatic complaints. It's a very rare inventory that we use in clinical practice because it only, get the specific symptoms. There are 46 questions related to physical symptoms, only physical symptoms in depression and anxiety. We know that the BSI was first published on the article in the British Journal of Psychiatry in April 1991 by David Bartwell Mumford from University of Bristol. I'm sorry if you cannot see this inventory clearly, but you can get it in internet. It's a free to download, or maybe you can contact Dr. David to come to this Bradford somatic inventory. So from the survey that we conducted, there is a top 10 somatic complaints about the depression and anxiety patients, and they complain about these specific 10 somatic complaints. The first, the most somatic complaints that the patients say it was palpitations, lack of energy, and pain. The other is aches in the abdomen, feeling giddy, feeling tired, excessive wind or belching, hearing buzzing noise in ears, time like a tinnitus-like syndrome, trembling or shaking, and mouth or throat felt dry. From the specific of this graphic, we know that it's a very common to see the patients with somatic complaints. It's a depressions and anxiety patients, but also complain so many things about somatic complaints. They complain about more than 10 somatic complaints when they diagnose as depressions and or anxiety. So the discussions of this survey is our result similar with previous study about the relationship of somatic complaints and psychiatric disorders. The previous study said that in the 430 patients with the diagnosis of major depression, 2/3 complain of general aches and pains. Somatic complaints in depressions, lack of energy, sleep disturbance, general aches and pain also reported in the previous study conducted by Dr. Tyler and friends. So I think the take-home message for my presentations is we as physicians must aware that somatic complaints sometimes cover the psychological symptoms of depression and anxiety disorder. We know from the study that patients, especially the elderly patients, mostly come to the psychiatric problem or to the physicians as a pain complaint, not as a kind of a psychological complaint. And when we talk about the complaint, the specific complaints that delivered by the patients to the physicians in the clinic is palpitations, lack of energy, and pain are among the most prevalent of somatic symptoms in depression and anxiety disorders. Maybe it can be different. I held a survey in Indonesia, but most of the studies related to the somatic complaints said that pain and also the fatigue is the most prevalent somatic symptoms of depressions and anxiety. And I think when we are treating somatic symptoms in depressions and anxiety disorders very well, we can also prevent relapse. Because if we are not aware of this, we are going to lose the patients. Maybe this is actually problems with some psychological or psychiatric problems, but because patients came to us as a somatic complaint, and we are going to lose these patients and cannot treat him well. So I think this is the end of my presentations, and I hope you have benefits from my presentation. Thank you very much. Arigatou gozaimasu.
Thank you, Dr. Andri. The floor is now open for discussion. I'd like to ask you a lively discussion. Please. For those of you who want to raise questions, please make sure that the microphone is on before you talk and give your names and affiliations when you start your question.
Thank you very much, Dr. Andri from Indonesia. My name is Hiroshi Shizu, Emeritus Professor of University of the Ryukyu Okinawa, Japan, one of the Vice President of Asian College of Psychosomatic Medicine. Depression patients also associate sexual dysfunction frequently in my clinic. So I will ask you, how do you think about sexual dysfunction associated in your clinic?
Thank you for the sexual dysfunctions of the patients with depressions were also in the survey. When we talk about the survey, and this is the questions about related to the problems of depressions and also the sexual functions. Have you had difficulty getting full erection, or have you felt that you have been passing semen in your urine? It's sometimes related to the patients of men. And in our clinical practice, patients specifically come to the clinic or come to me having a complaint of sexual dysfunctions are not very common. They sometimes complaints of sexual problems is related to the libido or to the desires of the sex. So it was said that sometimes they complain more about fatigue, or maybe because sex is not very common to talk about in a clinical. Maybe they ashamed of that, or maybe it is very private section. And then in the first hand, sometimes in the first interview, even I ask about the sexual problems. Sometimes they very reluctant to say openly in the first interview.
Thank you very much. Sexual dysfunction is very secret, so not frequently open. So, however, survey or sexual dysfunction will be recovered the depression and anxiety. It is very interesting.
Yes, I very agree with that. Thank you, Professor.
Are there any questions? Yes, please.
I always use some SDS score, and if the beauty point is over some bloods, so how do they correlate the SDS score? Whether it's severe or not?
I beg your pardon?
SDS score.
Somatic depression and scale? Somatic depression scale, yeah. I rarely use it in the clinic. There's a depression anxiety somatic scale in one of the studies, but talking about DAS or the depression and anxiety scale, it's also it also consists of specific psychological problems, and also the SDS also. Why I choose breadth for somatic inventory? Because it's very specific, asking about the somatic problems, not psychological problem. So the patients who follow this study or follow the respondents of the study is he had or she had to be diagnosed as depression or anxiety first, and then we asked more about the somatic complaints. So I think it's a good idea also to take the SDS in the next studies. Thank you so much, Professor.
Okay. So please.
Thank you for your wonderful presentation. I'm Yoshinobu Matsuda from Kinkichi Ojeso Medical Center, Osaka, Japan. Let me ask you one question. How did you choose the participants? So all participants had depression and anxiety?
Yes, this is one of the limitations of the studies, because we ask the patients only if they are already diagnosis, and this is what we said in the presentation. This is the internet survey base. So I think what I'm going to looking for in the first hand is about the kind of like the opportunities about either they understand about the somatic complaints of the patient. So this is not a clinical based survey. This is an internet based survey. So we ask the patient. Actually, they put it in the internet, the surveymonkey.com, and when the patient seems that I'm one of the criteria is meet with me, and then I will choose to fill the questions in the survey. But surprisingly, I'm very surprised about this. The result is it's also comparing to the other previous study with the sophisticated statistical analysis. It's quite rather the same. Kind of like most of the patients complain about edges, about pains, about palpitations, and also about fatigue. And previous studies said that the three kind of somatic complaints, edges, pains, and also the fatigue, is the most prevalent somatic complaints. And it is compared to my limited survey, it's a very still have correlations about that. And I think in the future we have to be more sophisticated analytics and statistic analysis.
So you use that data of patients with depression or anxiety?
Yes, we kind of like mix up, not specifically this is the depressions or this is anxiety, because the Bradford Somatic Inventory also said that this is not specific for depression. It is also can be used in anxiety patients with somatic complaint.
Thank you so much.
Thank you so much.